Hi, my name is Elisa Chauca. I'm going to talk about fracture prevention, why Zolendronate is older women, why osteopenia. Introduction. Definition is the term to define bone disease that is below normal bone not at low at osteoporosis. Zolendronate. Also called zolendronate acid and marked by numbers under the thread name zones and repeats and a phosphonate. Application is news. Definition: Osteopenia and osteoporosis is a varying degree of bone loss measured by bone mineral disease and marked for how strong a bone is at the rate that is make-break. The main way to determine your bone disease is to have a penis non-invasive test carried dual energy X-ray absorptiometry (DXA) that measures the mineral content of bone. Video.
Charlene Greenfield is in great shape. Good thing, because she's fighting a battle against osteoporosis.
When I got my first bone density test, I was shocked because I'm very healthy.
Osteoporosis is most common in women over the age of 50. It's a condition where the body loses calcium and vitamin D, which drastically affects bone health.
What happens is, as the calcium leaches out of the bones become fragile, brittle, and are at greater risk to break.
In early stages, doctors recommend calcium supplements, but as the condition worsens, treatment moves to drug therapies, ranging from once-a-day pills to once-a-year IV transfusions.
And they all work very well in helping to reduce the number of fractures in women going forward, but they also have side effects.
Chief among them, upset stomach. It caused Charlene to throw in the towel.
So I quit doing that. So I went to just taking my calcium and vitamin D supplements, and have been doing that, but my scores are continuing to go down.
So her doctor recommended a new drug.
The new medication that came out is called Prolia, which is a biologic drug, meaning it's really like an antibody that affects those cells that remove calcium from the bones.
It's a twice-a-year injection that promises the same result without disrupting the stomach.
And the biggest side effect is GI intolerance to the pill medication, and that's pretty much eliminated.
With 2 shots in 1 year under her belt, Charlene hopes she's winning her bone battle.
I'm due to have my next bone density scan in 4 months.
For Lee Memorial Health System, I'm Amy Osher.
Pros and cons. Pros: reduce the risk of fragile fracture in patients with osteopenia. Treatment of Page syndrome. Reduce the risk of mortality and vascular disease. Anti-tumor effects. Cons: adverse effects on AIDS. The most comes in acute peace region, while causes symptoms like fever, lethargy, decreases appetite, and hypotension. Video.
Hi, I'm Dr. Andy Thompson, and I'm a rheumatologist. Today, I'm going to talk about Zolendronate for the treatment of osteoporosis. You can visit our website, www.rheuminfo.com, and print off one of our Zolendronate picto pamphlets to follow along with this video. Zolendronate is also known as a class step. Zolendronate is given once a year by a 15-minute intravenous infusion. Now, there are 4 things you need to do when taking Zolendronate. First, to help build your bones, you need to take calcium and vitamin D. Your doctor will tell you the right amount of calcium and vitamin D for you. Second, Zolendronate should not be taken during pregnancy or breastfeeding. Let your doctor know if you become pregnant or are planning pregnancy. Third, medicines like Zolendronate have been associated with a very rare problem with the jawbone. Now, this problem has been seen after dental work. Let your doctor know if you develop sudden pain in the jaw. And finally, your doctor will monitor your response to Zolendronate by testing your bone mineral density. This is usually done every 1 to 3 years. After receiving Zolendronate, some patients have developed a fever and flu-like symptoms where they feel out of sorts or experience chills, fatigue, and weakness. Now, these symptoms are usually mild to moderate and go away after a few days. Zolendronate can cause a stomach upset with nausea, vomiting, or diarrhea. Zolendronate can also cause headaches or bone, muscle, or joint pain. Finally, Zolendronate has been associated with abnormal heart rhythms like atrial fibrillation. Tell your doctor if you've had a heart rhythm problem. If you're taking Zolendronate, you should call your doctor if you feel sick after the infusion or if you're concerned about any side effects. For Zolendronate, there are other specific reasons to call your doctor. If you develop stomach pain or trouble swallowing, if you're pregnant or planning pregnancy, if you develop new severe pain in the jaw, and finally, if you're having any upcoming surgery. I hope you found this video to be useful. For more information, please visit our website at www.rheuminfo.com.
HIV in Ecuador. Lower the prevalence of postmenopausic worldwide osteopenia is 14-15%. The date of prevalence in Ecuador. Conclusion. Zolendronate reduces the risk of fragility fracture in older women with osteopenia. Video.
In postmenopausal women with osteoporosis, bisphosphonates are first-line treatment for the prevention of fractures. Fractures can also occur in women with osteopenia, defined as a T-score between -1.0 and -2.5. Evidence for treatment in these women is lacking. Zolendronate, also known as zoledronic acid, is an intravenous bisphosphonate that is administered at intervals of 1 year or longer. In this randomized double-blind placebo-controlled trial, postmenopausal women 65 years of age or older with osteopenia were assigned to Zolendronate or placebo. The primary endpoint was the time to first occurrence of a fragility fracture, defined as any non-vertebral fracture, and vertebral fractures as confirmed by radiographic evidence. 2,000 women with osteopenia were randomized to receive 4 infusions of either Zolendronate at a dose of 5 milligrams or normal saline at 18-month intervals. After 6 years of follow-up, vertebral or non-vertebral fragility fractures had occurred in 122 women in the Zolendronate group as compared with 190 women in the placebo group, for a hazard ratio of 0.63. Women receiving Zolendronate also had a lower risk of non-vertebral fragility fractures, with a hazard ratio of 0.66. 1,017 serious adverse events were seen in the placebo group, as compared with 820 in the Zolendronate group. There were no cases of atypical femoral fractures or osteonecrosis of the jaw in either group. The authors conclude that in postmenopausal women with osteopenia, the risk of fragility fracture was lower with Zolendronate than with placebo. Full trial results are available at nejm.org.